Hi, I'm with Rachel Livingston, a qualified personal trainer who particularly likes helping pregnant women and women who've had their babies return to a level of fitness and in some cases improve their level of fitness. Thanks, Rachel, for speaking with me.
Thank you for asking me.
After a woman's had a baby, what's going on with her body and how does that impact her returning to exercise?
Look, we tend to have two motivations in getting back into exercise. One is people were really into exercise before and they want to get back to what they used to do. Secondly is where the body is kind of left not quite what it was and it's a little confronting and you want to kind of sort things out and feel better about yourself. So we need to go carefully. There's a lot of things going on in the body. The uterus takes up to 6 weeks to shrink, as you all know. The pelvis can take up to 3 months to restabilize. And if you had any particular hip or back problems, it may be a little longer. We've also may see some abdominal separation. And even if we don't have abdominal separation, the abs have still been stretched.
Yes.
The pelvic floor may be a little compromised. The breasts are larger and more tender. There may be a little more body weight than there was before, and all of these things are obviously going to affect how you're moving. The relaxin hormone still making you your joints hypermobile, and that can last 6 months for many, longer if you're breastfeeding, and in some cases up to 2 years.
Goodness, so they need to stay on track with someone who knows what they're doing.
Yeah.
So where would a woman start?
Okay, so the tendency is to do absolutely nothing and then try to return to what you did before. The most sensible way to see it is the immediately postnatal stage is like a rehabilitation stage. It's getting your body back to what it used to do before or what it is you want to do now. And we need to take this step by step. The first thing is to look after the pelvic floor and the deep abdominals. These have to be reactivated. The exciting thing about them is you just switch them back on and they already start to work better, as well as having the kind of longer term getting stronger. But this is the bit that we've got to look after. You can do that in like a few minutes a day, but that is the secret to getting back to everything else. So in terms of your back care, so you don't have backache, and also incontinence. If you're a runner, you don't want in a year's time to find out that you've got a pelvic floor prolapse.
Exactly, true. So how do they return to their exercise or previous exercise program?
Well, once you've got the abdominals and the pelvic floor happy, and if you haven't been able to do that by yourself or just with your trainer or an exercise class, then you need to see a physio about it, and they can use an ultrasound machine to give you special feedback on that. But once you've got all that in order, you can slowly start to introduce everything else. We need strengthening exercises for the upper body because you're now carrying a baby. You know, you're breastfeeding, you're settling, you're lifting capsules out of car, baby out of bed, baby out of bath. There's more lifting than you've probably ever done before. The chest muscles tend to shorten, so lots of stretching for the neck and the chest. There's a lot of bending and carrying, lifting things off the ground. So you need to do squats and lunges, strengthen up your legs, make sure they're really mobile. Then you can just slowly add back in other activities that you used to do, being cautious with things that have high impact or a lot of bounce, because obviously that can affect the pelvic floor and if your breasts are larger. In terms of footwear, really good footwear. The feet have often splayed a little in pregnancy, so they need good support, as do the breasts. Good sports bra as well. And remembering hydration and good nutrition.
So when would you, with women who are breastfeeding, when should they exercise?
Look, they can come back. It doesn't matter whether you have a vaginal or a cesarean. You can come back to exercise within a few weeks. It's just about that step-by-step progressive approach. And if you are doing everything moderately, having good nutrition and good hydration, it's not going to compromise your breast milk.
Good. And obviously, I think you breastfeed before you exercise, just to make the breast feel a little bit more comfortable.
If you need 2 bras, you can do that as well. A bra plus a sports top is maybe a better option than trying to go 1 bra.
And certainly with bras too, it really doesn't matter what sort of bra you do use, as you say, a sports bra, as long as it's well fitted. I think the big mistake is that women think that they can get back into perhaps a sports bra they were using beforehand, and that can certainly compromise their breasts. But that's very useful. So final words of advice with exercise and post-baby.
Yeah, I guess just remember, you were pregnant for 9 months. You're not going to get it back overnight. Go step by step. Be kind to yourself and see exercise not just about fitness and strength, but also about joining up with other women, having some adult time, getting out in the fresh air, vitamin D, socialising, all of those things as well. Because it's not just about physical health, it's about mental health as well.
And there's certainly a lot there in the research and in the papers to suggest that exercise helps prevent postnatal anxiety and depression.
Absolutely. It gives you a sense of confidence and coping, and just getting out of the house and doing something can prevent that snowball effect of feeling like you're not coping.
Absolutely. Rachel, wonderful advice. Thank you very much.
Thank you, Lynn.